Hello, I'm Mahinur Salema, an OET instructor. I've been teaching OET since 2017, and now we are going to have a look on a letter and discuss how we are going to write it. It's type 2 letter, and I guess you need to know the types of letters that you are going to write because each type has a specific type or specific themes that you are going to write with. Okay, because you write with the Semitic style and you don't mix data, you just write each paragraph uh, with one central main idea, okay, and you don't mix any information together. Okay, let's go to this letter. We are writing to a psychiatrist, okay, because the patient has depression, severe depression and bipolar disorder. Okay, and you are referring to the psychiatrist for urgent assessment and treatment for depression, suicidal thoughts, and bipolar disorder. Now you are going to read today's visit. It's very important to read it before you start reading the rest of the letter because you need to know what are the relevant data that you are going to choose, and this will help you 100% to choose the right and the appropriate case notes and the relevant case notes for this task. Okay, so we will read uh, today's visit, and sometimes today's visit is not a complete visit. It's just test results or maybe medication or something like that. So be careful. When today's visit is not a complete task, you can't start with the letter with it. Okay, you can't use it as the first theme of your letter because you need to combine it with the visit before it, the visit that you order the investigations or you prescribe the medication. So be careful of this point because it's really confusing. When you have an urgent condition, you have to start with today's visit. No, this is not a rule and this is not always correct. Okay, you need to evaluate today's visit to check if it's a complete visit or not. If it's not a complete visit, okay, you can combine it with the visit before it, or you can start chronologically if the reader or the recipient won't understand the condition without the development of the condition or the summarization of all visits. Okay, you are not going to summarize today's visit. Okay, you are going sometimes to exclude some information that you feel it's not beneficial or maybe negative data. And not all the negative data you can omit, by the way, or you can ignore. Only the data that will not make a difference with the reader. Okay, so you will pick this. Okay, field tires. Okay, household. Uh, okay, overwhelmed with responsibilities. Refusing food. Okay. Nothing here is important. Okay, so today's visit, you need to evaluate. This is very important to evaluate your paragraphs. Okay, today's visit will be about 2 or 3 sentences. Okay, only symptoms, and you can add this one: contact husband to discuss childcare, or can you write it in the conclusion? Whatever, both are correct. Okay. After that, you will go from the beginning of the letter. You will start from the beginning to try to collect, to choose data and collect the relevant data, okay, depending on who you are writing to, why you are writing to him, and today's visit. Okay, so I will go to the beginning of the letter. So I'll find no history for the patient is important at all, only that she, okay, has a family history, no hobbies or sports. This one, husband, parents, and live in other states. She lives alone. Okay, after that, now the history is done. You evaluate the history, evaluate where you are going to write the history. If the history has medical, clinical information about any chronic medication related to the main medical issue you wrote in the intro. Nothing else. Medical history for the patient, himself or herself. She has hypertension for which she is on this medication. She has whatever, but it's related to the main medical issue. If she has lung carcinoma, so she's smoking is very important. Okay, if she has been smoking for a long time, or she is on an medication for this for a long time, if she had chemotherapy before, whatever, anything related as medically to the main medical issue which you wrote in the intro should be written in the history in the first paragraph. Okay. So you give priority to the history if it has medical history to the condition that you or the medical issue you wrote in the intro. You give it priority. If not, just family history, just anything else. Okay, and it's a kind of not primary data. Okay, you can write it before the conclusion. Okay, so because you have an assessment criteria for organization. So if you wrote such a history in the beginning, that means you don't write according to the purpose. So this will reduce your purpose score, and you are also not able to organize the paragraphs as it should be logically. Okay. After that, I will go to the 2 visits, and I will find that nothing related to bipolar disorder or depression in those 2 visits. So I have a problem here that how can I complete such a task? Okay, you will read the 2 visits to think about any other theme that is maybe related, risk factors, okay, anything related to the main medical issue. But in this task, you are not going to find anything related to the main medical issue. Okay, only patient feeling well and energetic, too busy to come to schedule, review, nothing related to the main medical issue. So if I wrote such data, that means I'm going to include irrelevant data. Irrelevant data will reduce your score in consensus and clarity. Okay, according to the assessment criteria, will reduce your score dramatically. So be careful, okay, not to include any irrelevant data. This is the second type of referral letter. This is the second type of referral letter that has irrelevant visits. And here you don't need to summarize. You need to expand and to find the theme that is relevant to the main medical issue. There is a theme relevant to the main medical issue that you need to observe, and you need to read very well. Maybe you are going to find it in today's visit. Maybe you are going to find it in the other irrelevant visits that you will find risk factors. You will find other diseases maybe related to the main medical issue, and maybe its medication or the medication is the cause of what's the patient is suffering from today. Any kind of data that is not really primary ones, okay, only data about her life, her work, her job, stress, any history, anything could be the paragraph. The second paragraph will carry all the data that is really not primary as the medical ones. The medical clinical information has the priority, of course, to be written in the first or the second paragraph. Okay, so let's go to one of my corrections to check. Okay, here we can find one of the corrections. Okay, you can find this layout is good because the paragraphs, okay, are really of the same size and into themes. Okay, I'm writing to urgently refer Mrs. Walter, a 40-year-old housewife, for acute management and investigation of severe depression, because severe depression is already confirmed, okay, and suspected bipolar disorder. Okay, suspected here means this is suspected, but the severe depression is already confirmed, and it's really normal to have multiple medical issues. on today's visit, because I have a complete visit with symptoms, so I will write it. Okay. She has, but write it in your own words, but with medical English, reported having feelings of refusal to cope and thinking of dying along with insomnia, despite being tired and having lack of energy. And after you wrote the symptoms, okay, you will go flashback. Flashback to Mrs. Walter was feeling well and energetic. This is the information that he needs to know. It's related to, it should be related to the depression or the diagnosis written in the intro. Okay. Additionally, she was interacting in social activities and was training daily. And the student find himself that he can't reach the word limit, so he included irrelevant data. Okay, never do this because this will reduce your score to 4 out of 7 in consensus and clarity. So don't do it. Okay, how can I continue the letter? Okay. How can you continue the letter? You need to connect. Okay. And to find the hidden theme. That type of letter we call it hidden theme. Hidden theme because it has a hidden theme. You can find the relevant information directly, which is going to be in the first paragraph, but in the second paragraph, sometimes you don't know what to write. Okay, here you can include the history in the second paragraph. By the way, you can't write it alone, or you can include it in the history because it has no priority to be written in the beginning of the letter. Okay, what should we write here? Let's go back to this letter and to check the two uh, body paragraphs. Okay, the first one, you should write the symptoms. Okay, with persistent fatigue, trouble sleeping, associated with loss of appetite, all the symptoms together. In addition, she stated having feelings of not copying, comma, a desire to die and being overwhelmed with responsibilities. This is balanced listing. Be careful while you are listing because I'll make a video about listing in OET. Okay, listing, when you make a list of symptoms, of recommendations, of examination findings, you need to keep the list balanced. Okay, and you need also to vary your sentence structure. Okay, not all the sentences starts with she. Okay, remarkable weight loss was noticed. Okay, contacting her husband is necessary to discuss, and so on. The second paragraph, the hidden theme, is very important to link it with the main medical issue or the purpose. Mrs. Walter has had 2 visits to the clinic over the last 6 months. Those visits were irrelevant, in your opinion, but there is something relevant here. Her main complaints were regarding being tired and overweight. On her last visit 2 months ago, she was energetic and reported weight loss and participation in social activities with total disappearance of any depression symptoms. This, okay, by this way, you got the hidden theme, why he's writing to you these case notes as long as it's not relevant, because he wants you to tell the doctor that at that time when she visited the clinic 2 months ago or 6 months ago, she hasn't had any depressive symptoms. Okay, and then after that, the conclusion. Okay, don't write memorized sentence. Okay, right, I'm referring Miss Walker because I believe she needs immediate management due to the severity of her condition. Okay, you can add, please contact her husband here, or you can add it up. It's okay. It's very important in type 2 that you find and collect data in the second paragraph. The second paragraph in this type of letters is really important, okay, to be written in a good way, because this will affect consistency and clarity, content, and organization. So this will hit in depth 3 of the assessment criterias if you didn't got the hidden theme. I hope this mini session is really useful for you. If you have any questions, you can contact me. And I will explain again on another letter, the same type of letter. The second type of referral letter, the hidden theme type, okay, or we can say the irrelevant visits type because it has relevant and irrelevant visits. See you soon. Bye.